either a short femur or short tibia. The leg bone is physically shorter. How do you measure that? How do you quantify that? How do you intervene? And a lot of times what's happening is these patients are being told that something is misaligned in their pelvis causing the short leg. Hey everybody, Dr. Todd from Gonstead Spinal Wellness. On this video, we're gonna take you through, I believe, 18 patient adjustments showing how we do a Gonstead adjustment. This is a piece of an afternoon shift. We recorded this in time lapse, so it went very fast. We got everyone's consent to be able to use this footage, so thank you to all of our patients that are allowing us to share this with the world to show them how this process looks. Before we jump into that, make sure a couple things. Make sure you subscribe to this channel if you haven't already. Share this with others that you think this would help. Like this video, all those things are very helpful. Also comment below and let us know what other content, what other things you'd like to see, questions that you have. Keep in mind as well, we serve two different audiences on this channel. We serve our community and patients that just want to learn about good, healthy content so they can live a life of health and wellness and certainty. And the second audience is chiropractors. We teach chiropractors how to put corrective exercise and functional movement into their practice. That's Move Now University. So both of those, you'll see some stuff here below. You can look in the description below to find out even more information. But before we get started on taking you through these 18 different patients that we adjusted, a couple things that I just want to say is this is just a piece of what we do in our clinic. This is showing the segmental component as far as how we look at the individual segments of the spine or the extremity joints. Some of these adjustments, you'll see that we work on things like elbow, wrist, knee, sinuses, ears. So there's multiple things that can be checked and adjusted because those things can misalign. But that's just the segmental component. We also look at posture and we do things with curve correction using traction and functional movement and corrective exercise, which is a big part of what we do. In other videos, if you want to see the overall case management of how we go through the adjusting, the traction, the exercise, the case management, the patient resources, make sure you check that out. There'll be a link up here so you can go back to a video where we cover that in detail. So with that said, let's get started. Okay, so first off, we're checking this patient here. We're scoping, I'm adjusting her neck. She's face down on the high-low table. That's that table that goes face down. I worked on her knee. She's on her side. I checked her knee again, and she's done. Okay, on to the next one. So this patient also had a knee issue, so ironically enough. And so we talked about the knee. We worked on her. And something I just want to say, and we checked the knee again. Okay, talked a little about the knee, described where the swelling is at. So now a side note on the knee and other extremity joints or spinal issues as well, but especially with the knee, depending on where the pain is, the mechanism of injury, as far as did they twist it, did they get hit from the outside of the knee to the inside, does it bother you walking up or downstairs, does it bother you in a deep squat? Those pieces of information help us hone in on what probable structures are injured and also gives us an idea of how to adjust the knee if it is an alignment issue. So these are all details that we ask on a case history or on a visit by visit basis in this case. Something else to note that you'll see with a lot of these adjustments is we start off by checking the patient in the seated position. So they're in the chair. We use a little instrument that measures temperature from side to side. We run that down the spine. If it gives us a reading, it helps confirm that that's the level of the spine that we're going to be working on and adjusting that day. Keep in mind, all of these patients have had a very thorough initial workup. We have x-rays of all these patients. We have a lot of history and exam findings prior to the visit that you're seeing here today. So there's a lot of backstory to all of these individuals. Each visit might take only 4 to 5 minutes to check them and adjust them, sometimes a little bit longer depending on what's going on with them. And the whole pattern of how we do this is because I have them in the chair to begin with, I check them and I adjust them there in the chair. So if there's something in the cervical spine and the neck, I'll adjust them in the chair first. We bring them over to the high-low table that goes down. I'm then counting down to the segments that we're going to adjust. I'm usually standing on the left side of the table. I rarely walk around to the right. I talk about this in another video that technically the technique in Gonstead says you should stand on the side that you're adjusting. I reach over, I make sure that the vector of how I'm adjusting the joint, so the angle in which I'm pushing the bone forward, is still in accordance with what I see on x-ray and exam findings. These are nuances that I do after being in practice since 2003. These are just things that I've honed in and felt work really good for my flow and have not affected anything with patient outcomes. And then the patient goes into the sideline position if we're going to adjust the pelvis, sacrum, or lower lumbar spine on their side. You'll notice if you watch this in fast motion, you'll see seated, face down, side, seated, face down, side. And someone with an untrained eye could look at that and say, oh, he's just doing the same thing on every single patient. Keep in mind, there's 24 joints in the spine. With these patients, it's different segments, it's different angles. Sometimes on the side, it might look like we're adjusting a lower lumbar. It could be a pelvis, it could be a rotated sacrum. So all these little nuances, those are just things I wanted to point out so that for the layperson watching this, especially in fast motion, you can see that there's a lot more detail that goes into this. So with that said, let's get back rolling. Okay, so this is another patient. This is a Pilates instructor. She's actually a really cool case in the sense that she's got a really bad fifth lumbar in her low back, and she's been to multiple other chiropractors, does Pilates, does lots of exercise, and just had this nagging low back issue. Certain movements would bother her. Nothing helped her. This is someone that after we adjust her fifth lumbar one time properly and we set it forward, and she said, wow, no one else has ever been able to move that joint like that. She had great results. And that's a really cool thing about the Gonstead method of chiropractic, in that we're so specific and really moving and setting a vertebra in isolation and try not to affect other vertebra around it. That precision and that specificity is what yields such great results. We'll keep going. Okay, so we're discussing a little bit. And then next patient, okay, so this is a patient of ours that is a bodybuilder. Interesting case here. This is something that we'll definitely do another video on, because his story is pretty significant. He has about a 1-inch short leg on one side. He had a broken femur as a kid in a dirt bike accident, and his whole pelvis was unlevel. His spine was bent because of it, and he was squatting and deadlifting on a unlevel foundation, which, as you can imagine, do you think that's good? No, not good. So it caused all kinds of low back pain, leg pain, sciatica, which is like nerve pain going into the leg. He had all these symptoms and problems, and no one ever just said, you have a 1-inch short leg. You need to put a lift inside of your shoe to build this up and start to level the pelvis as we align the joints and work on you with spine remodeling traction and corrective exercise. And so now he's doing great, and he's thrilled because he's doing so well. But this is something that unfortunately was just missed by other people that he'd seen in the past. Okay, so adjusting L5, explaining some things. And that's Jenna over here by the computer. So she's the one she's my scribe. She's taking notes and helping out. All right, so another patient. So we're scoping first. So we're checking to see what's going on to confirm if we're gonna work on the same segment. All right, setting a lower cervical vertebra. And now she's going down on the high-low. So I'm walking back and forth to my computer, looking at the exact segment and how it adjusted. That was a pull move on the low back. So it's a little bit different than a push. So anyway, those are some semantics. Those are details we'll get into in other videos. All right, this other patient of ours. This is actually the one that we work on her sinuses. So you can see this at the end. This has been really helpful for her. And then this gal over here in the corner, she's actually observing. She's in this video a little bit later, so she's a patient and she's also a student. She's doing a school paper on our clinic, and so she asked if she can come in and observe for a couple of hours, so she got to meet a lot of our patients as well, which was really cool. All right, and then right here, so that first move is actually compressing the frontal sinus. So it's not moving a bone, it's not realigning something in the skull. It's called a sinus adjustment. It's really a pumping motion, and there is a minute amount of movement in the skull, primarily from pressure. When the patient is a child and prior to all of these suture lines in the skull fusing, there actually is a lot more movement. But as an adult, really, there's not a whole lot of movement. I mean, it's microscopic at most. It's more of creating pressure. So there's certain points you can compress and put pressure into the sinuses that really helps when someone has allergies or plugged up sinuses. So in this case, we've learned with this patient that every time I see her, I work on her frontal sinus, her maxillary sinuses, which are right here, and then we adjust her ears. We actually pull her ears back and down, and that will cause this eustachian tube or inner tube in the ear to open up, and it will actually make a popping sound. So it'll actually go. It's something we do a lot with kids that have ear infections. Lots of times kids that have chronic recurring ear infections, many of the times they don't need antibiotics, and the antibiotics will make them much worse. Many studies are out showing the danger of turning to antibiotics with these kids when they have an ear infection instead of trying to find something more holistic. In this case, we go to the mechanical and neurological origins that could possibly be a cause of this, which is checking and adjusting the upper cervical spine. Those nerves control everything in the head and neck, and making sure that the actual ear itself is nice and open and patent. Okay, that can be done with this adjustment. It opens the eustachian tube. If that tube starts to flatten, almost like a straw that you like drink a drink with, the straw can collapse. When you pull it, opens up the straw. That is probably the best analogy to keep it simple. So we work on the ears, and then she's on her way. Next patient. All right. This is a patient we saw years ago, came back in, had another injury and going through a corrective phase of care again, unfortunately, but now he's back on track. All right, this is a patient that we did a full video talking about his thoracic hyperkyphosis. We'll link that above, and you can see a full workup on this patient. This is Roger. Okay, so make sure you check that out. We have a full detailed out just case management of Roger. All right, patient here, she's pregnant. Yes, we take care of pregnant patients. There's a huge benefit for pregnant patients getting checked and adjusted throughout their pregnancy. That table over there, if you see, I don't know if you saw that, let me back that up a little bit and I'll show you. If you see what I do with the table, see how I just lock this table down? I don't know if you can see that, but see, yeah, so this table's locked down. It's done like that to accommodate the belly of the pregnant mom, which is cool because a lot of times pregnant women will say, this is the first time I've actually gotten to lay face down since I've been pregnant. So it's a very comfortable position for them, and then that's the most advantageous way to adjust the spine is in the face down position. You need a table like this to be able to accommodate a pregnant patient. Or over here in the corner, okay, kind of where I'm at, you probably can't see it, but it's kind of like where I'm positioned, there's what's called a knee chest table. That's another way that we can work on a pregnant patient. All right. And then sideline adjusted, and she is on her way. Okay, this next patient, runner, major neck issues after a car accident, been to multiple chiropractors. We were able to adjust her and fix her. And I think the biggest difference with it was that we were able to set the vertebra forward without twisting, and that really worked well for her, which is something we see with a lot of our patients that maybe don't respond well to twisting types of adjustments. In the Gonstead method, we set the bone forward without rotation, without twisting. So especially the neck, it's adjusted seated, the doctor's standing behind the patient. We are moving the bone from backward to forward, or the patient's face down on a table and we're setting the bone from backward to forward. Different vector, different way that we're moving the bone, and it yields different outcomes in a lot of patients. Okay, so we have another patient here. All right. He's getting adjusted, adjusting his low back. All right. And here's another guy here. This is actually a guy that helps us quite a bit and has trained me quite a bit in the video editing. This is a friend of mine, Alan. And so Alan's making his debut right now in our video. Good job, Alan. All right, and something that you won't see in the sped up version is Alan has this breathing thing that he does to get himself to relax, where he goes, which is derived from a type of martial art that he studied. And the funny thing is when he can't relax and he's tight, he goes through this little breathing, and I've never seen it quite like this before, and he's able to relax. A lot of patients like to time breathing in and breathing out when we adjust them. I don't typically like to do that because I feel like that telegraphs our punch. With the Gonstead technique, in most cases, Alan aside, we are really feeling what's going on with someone's relaxation. We're timing it. We're trying to be aware of their breath without having to cue them into breathing in and breathing out. So some other doctors like to do that. I prefer not to do that. Some patients like to do that. So we'll definitely accommodate for the patients. I feel like that works better for them. All right. And then, all right. All right, here's another patient. This is also a guy that's got a pretty big short leg, bodybuilding dude, power lifter, and just lifting on an unlevel foundation. Such an important thing to identify is a difference in leg length. And this is one of these things that we will do some other videos just on leg length analysis. I've been in conversations with other medical doctors, physical therapists, other chiropractors, neurosurgeons. This is a really misunderstood piece of what we do in healthcare, is how do you measure a anatomical short leg, so a difference in leg length, either a short femur or short tibia. The leg bone is physically shorter. How do you measure that? How do you quantify that? How do you intervene? And a lot of times what's happening is these patients are being told that something is misaligned in their pelvis causing the short leg. I'm not saying that that can't happen, but I'm saying that it would have to be a massive misalignment in the pelvis, and the sacroiliac joint, the joint between the pelvis and the tailbone, would literally have to almost dislocate to cause that much of a difference in most of the cases. So in the case where the pelvis is misaligned drastically, that can alter leg length to a very small degree. A dropped arch in the foot can alter leg length to a small degree. But when someone has a 1-inch difference in leg length, the only way that that's happening is they have what's called an anatomical leg length inequality. What does that mean? That means that a bone is physically shorter. You're not going to adjust that away. You're not going to exercise that away. The only way to change this is to intervene and either have the patient build up the shoe if it's a big enough issue, or put a lift inside of the shoe. You can only put so much lift inside of the shoe before the heel starts to pop out of the heel cup of the shoe. So that's where we then send people over to a specialist in town that actually disassembles the shoe, puts in material, builds up the sole of the shoe. That's what we recommend in a patient like this and in our previous bodybuilder patient that we showed you. It's kind of ironic that we see these, power lifters and bodybuilders that have these massive differences in leg length, and they're lifting on this and they're wondering why they have sciatica and lower back pain and bad discs in their lower back, and no one's ever caught this stuff before. So this is so crucial, so important. This is why I recommend any human being get a full spine x-ray, proper analysis, age 3, okay, minimum. So meaning as soon as you're 3 years old, you should be getting an x-ray. And prior to age 3, if there's significant trauma, even at 2 or 1, we take x-rays of little kiddos at times too. But typically in our clinic, age 3 and above is kind of like our point that we will always want to get a baseline to see what's going on. Because from a child standpoint, from a parent standpoint, once parents understand the importance of spinal development and spinal health, a very powerful thing to contemplate is, as a parent, if you're watching this as a parent, do you feel like it's your responsibility to know how your child's spine is developing? If it's not yours, whose responsibility is that? It's your kiddo, right? So yes, it is. This is the way that you do that. All right, moving on. All right, this is actually our patient that was observing, and we don't go through an adjustment here. I actually go through a case management. This is a pre and post x-ray analysis. She's at the end of a phase of care. I'm explaining what kind of changes she made. I was just pulling up something called the wellness score, which is actually a grade that she received before and after. So she gets a letter grade on 21 different parameters that we go through and we measure with her overall health. And then it's printed out for her so she can see, oh, I started off as a, and I'm not sure exactly what she was, but let's just say she was a D+. And then she went to a C+. And she can see that percentage-wise, she might have gone from a 68% to a, 77%. And she can say, wow, that's really great. I made this improvement. So it's tangible, measurable improvement, objective improvement. We do this on this thing called the wellness score. It takes all these parameters, all these things that we measure with our patients, puts it in one place so they can see the entirety of their care over a 12-week period, because we typically take care of someone over a 12-week phase of care before we then repeat a lot of these objective tests. One of those things being a comparative x-ray in a lot of these cases, comparative functional movement assessment, comparative activities of daily living, lots of objective things that we want to measure. So it's not just, well, I came in with neck pain and headaches and my neck pain and headaches is better. Great. You can get rid of a symptom by taking a drug. Does doing that fix the cause of the problem? No. We want to make sure that we are measuring root cause functional outcome problems, structural problems. We want to measure those things, quantify them, and have comparative data. Then when we go through, we're explaining, we're showing her pre and post, wellness score. She gets a printed out copy of her comparative x-ray so she can see it. She can see that her cervical curve improved. And then I'm writing out, I'm saying, hey, remember 12 weeks ago when we talked about at this point, what's the next step? Here's some options in care as far as how to take care of you moving forward. Here's how much more change I think we can accomplish. All right, this next patient, this is a young lady. She's there with her father in the corners. Of course, just like everyone, they consented to allow us to share this, okay? And she was in a car wreck and had a couple things that were bothering her. And interestingly, A big thing with her is that she has some segmental instability in her neck. So what does that mean? That means some segments in the neck are moving too much. And I talk about this in a previous video, so watch, so right there. So I'm showing bending x-rays. We're showing bending the head down, bending the head up, and we're measuring how much a bone is sliding forward or backwards in those bending motions. Ideally, a bone should not slide forward or backwards really at all. And there's a very small tolerance of how much a bone should move around when someone bends the head forward and bends the head back. It's technically less than 1 millimeter, so it's a very small amount. We go through and we measure this down to the fraction of a millimeter so that we can identify if there's something called spinal ligament injury or alteration of motion segment integrity. That's the fancy word for it. And so in this case, this is where we can identify and quantify if someone has an actual injury, even if they don't necessarily have pain at the moment. Very, very important. All right, moving on. Okay. So we chat a little bit there. I'll forward this and then on to our next patient. All right, remember we had about 18 patients, I believe, going through this. This is about 75% of a shift that we would do in the clinic. So this is just showing the flow of what we do on a daily basis, working on his elbow, wrist. And then the funny thing here is I actually went over to Jenna and she said, hey, can you check my elbow too? And I said, sure, let's check your elbow too. So I adjusted Jenna's elbow as well. All right, we have to take care of our team. All right, and then this patient here, she is a runner, cross-country runner. I believe cross-country, maybe. I might be misquoting, but runner nonetheless. And working on her, working to make some great changes. You can see on this x-ray over here, a slight scoliosis. So a very specific way of working on that and adjusting her, working on her pelvis. And I believe that is it. All right, so there you go. That was a piece of an afternoon shift of how we take patients through and adjust them. Now keep in mind, in our clinic, we have other departments that are simultaneously going. We have a full traction department, exercise department. We have multiple staff in our clinic that are helping patients through this process of their visit. So it's not just them being in the room with us as the chiropractor. That's one piece of their visit. I hope you enjoyed this. Comment below. Let us know what you thought, if you like this style of video, if you want to see more like this. If you haven't subscribed, please subscribe, like, share, okay? You can do that. And then in addition, if you are a patient, if you're someone that wants to look into coming to see us, our number is here below. You can reach out to us, Gonstead Spinal Wellness. If you are a chiropractor that likes this whole style of practice and you want to learn how to possibly do this in your clinic, reach out to us as well. Move Now University. Information is below as well. So that concludes this video. I hope you loved it. I had fun going through and narrating it and filming this. We're so grateful for all of our awesome patients for allowing us to share this. So thank you, patients. If you're watching this, when it comes to the health of you and your family, results matter most.